The deep group of extensor muscles include supinator. In order to see the supinator, you have to just reflect the lateral group of muscles here. You can see the radius is wrapped up in the upper part by the supinator. So this is the supinator muscle. Then we have abductor pollicis longus. So you can see this is the muscle abductor pollicis longus. Running along its medial side, we have extensor pollicis brevis. This is the extensor pollicis brevis. Just medial to that, we have extensor pollicis longus. So this is extensor pollicis longus. And the last deep group of muscle is extensor indicis. So this is extensor indicis. In order to see the extensor indicis, I have just reflected extensor digitorum and extensor digiti minimi. So just beneath these both in the deeper aspect, we will be able to identify the extensor indicis muscle. So now we will see the origin, insertion of the deep group of extensor group of muscle. First we will see the supinator muscle. As I mentioned, supinator wraps around the upper 1/3 of the radius and consists of superficial stratum of muscle and the deeper stratum of muscle. The fibers of superficial stratum arises from the lateral epicondyle of humerus and from the two ligaments, that is radial collateral ligament and annular ligament of the elbow joint. Whereas the deep stratum muscle takes its origin from a crest called as supinator crest of ulna and a depressed triangular region in front of that. Insertion is the superficial fibers slopes downwards and forwards and are attached to the upper 1/3 of anterior part of lateral surface of the radius above the anterior oblique line. So let's identify here. This is the anterior oblique line of the radius. Here this is the insertion of pronator teres. Above the insertion of pronator teres, we can see the supinator superficial fibers are inserted to the anterior oblique line of the radius. This is supplied by the posterior interosseous nerve before the latter passes between the two. So here you can see this is the posterior interosseous nerve. Before it passes between the superficial and deep stratum, this posterior interosseous nerve supplies the supinator muscle. The action of the supinator is it acts as supinator in the extended elbow, as the name is suggesting. It fixes the forearm in supination position. Next deep muscle is the abductor pollicis longus. So this muscle what you are seeing here is abductor pollicis longus. So pollicis means it has to go to the pollex. Pollex means the thumb. So here when I am pulling this muscle, you can see the thumb is getting abducted here. So this is abductor pollicis longus. So abductor pollicis longus arises from the posterior surface of both radius and ulna. So if you are identifying this muscle here, you can see the fibers that is taking origin from the posterior surface of radius and ulna. So from both the bones it is taking origin. Then the muscle passes downwards and laterally just above the extensor retinaculum. You can see that the muscle is crossing the tendons of brachioradialis and extensor carpi radialis longus. So here you can see the way the abductor pollicis longus is crossing laterally the insertion of the brachioradialis muscle. It passes beneath the extensor retinaculum and it forms the boundary of the anatomical snuff box. You can see here, this is the anatomical snuff box, this one. So it forms the lateral boundary of anatomical snuff box, and the tendon is inserted to the radial side of base of first metacarpal bone. This is the first metacarpal bone. This is the abductor pollicis tendon that is inserted to the radial side of base of the first metacarpal bone. The nerve supply is by the posterior interosseous nerve, and the action is it helps in the abduction and extension of the thumb. Next is extensor pollicis brevis. This is the extensor pollicis brevis. You can identify as it runs along with the abductor pollicis longus. So this extensor pollicis brevis is a slender muscle that arises from the posterior surface of radius below the origin of abductor pollicis longus. So you can see this is the origin of abductor pollicis longus from the radius. Just below the origin of abductor pollicis longus, there is origin of extensor pollicis brevis. And also it takes origin from the interosseous membrane. It lies medial and close to the abductor pollicis longus. The tendon of both the muscles, abductor and extensor pollicis brevis, lodges in a groove on the lateral side of distal end of radius. It passes beneath the extensor retinaculum and goes and gets inserted into the base of the proximal phalanx of the thumb. Let's identify the tendon here. This is the tendon of extensor pollicis brevis. So I am pulling the muscle. You can see the tendon is also moving here. So this is the insertion of the tendon of extensor pollicis brevis. The nerve supply of this muscle is from the posterior interosseous nerve. This is the posterior interosseous nerve here. This slender muscle, this slender nerve. You can see the nerve here. So that's the nerve supply to both abductor pollicis longus and extensor pollicis brevis. Action is it extends the thumb. So it is helping in the extension of the proximal phalanx of the thumb. Next is extensor pollicis longus. This muscle is extensor pollicis longus. This takes origin from the posterior surface of shaft of ulna. So you can see here, this bone is ulna. This is ulna. So extensor pollicis longus takes its origin from the posterior surface of ulna below the origin of abductor pollicis longus. This is the abductor pollicis longus taking origin from the posterior surface of ulna. Below the origin of abductor pollicis longus, you can see the origin of extensor pollicis longus from the posterior surface of ulna and also from the adjacent interosseous membrane. The muscle forms an elongated tendon which passes beneath the extensor retinaculum and lodges in a groove just medial to the dorsal tubercle of Lister of radius. The dorsal tubercle, it acts as a pulley around which the muscle tendon changes its direction and passes towards its insertion. Finally, the tendon of this muscle goes and gets inserted into the dorsal surface of base of distal phalanx of the thumb. The nerve supply is from the posterior interosseous nerve, and the action of this is, as you can see, it is helping in extension of the distal phalanx of the thumb. Next muscle is extensor indicis. Let's identify the muscle first. This is extensor digitorum, extensor digiti minimi, I'm just reflecting both the muscles. So you can see here, this is extensor indicis. As you can see, this muscle takes its origin from the posterior surface of ulna below the origin of extensor pollicis longus. So just distal to the origin of extensor pollicis longus, you can see the origin of extensor indicis here from the posterior surface of ulna. This muscle forms a tendon that passes along with the tendon of extensor digitorum in the fourth compartment, and both of it share a common synovial sheath. It passes beneath the extensor retinaculum. You can see the tendon is appearing in the dorsum of the hand here, and at the head of the second metacarpal bone, this indicis tendon joins with the ulnar side of the index tendon of extensor digitorum going to the index finger. So this indicis will join the dorsal digital expansion for its insertion. The nerve supply of this muscle is by the posterior interosseous nerve, and the action of this is it helps in the extension of the index finger. Next, talking about the anatomical snuff box, which is a triangular depression and becomes more evident when the thumb is extended. So you can see here, this triangular depression is anatomical snuff box. Let's see the boundaries first. Anatomical snuff box is laterally bounded by the tendon of abductor pollicis longus. Just medial to that, we can see extensor pollicis brevis. So these two muscle tendons are forming the lateral boundary of anatomical snuff box. Medially, extensor pollicis longus. So this is the medial boundary. So this is the triangular depression that is very nicely appreciated when the thumb is extended fully. Now the roof of this is formed by skin, superficial fascia, where it shows the beginning of the cephalic vein. So here you can see this is the cephalic vein. It is crossed superficially by the superficial branch of the radial nerve. After superficial fascia, there is deep fascia. Now talking about the floor of the anatomical snuff box, here there is the styloid process of radius, scaphoid, anterior to that trapezium, then base of the first metacarpal bone. So this forms the floor of the anatomical snuff box. The content of this is, you can see the radial artery here. So this forms the content of anatomical snuff box. Next, we'll see the extensor retinaculum. To define it, it is a oblique fibrous band that is attached laterally to the anterior border of radius. So the fibers of extensor retinaculum slopes downwards and medially, and it is attached to the pisiform bone and the triquetral bone. The retinaculum is not attached to the ulna, otherwise it would prevent the pronation. Beneath this extensor retinaculum, there are 6 compartments, and each compartment we can see the long extensor tendons are passing. So let's identify those compartments and the contents of each compartment. In the first compartment, we have the tendon of abductor pollicis longus and extensor pollicis brevis. In the second compartment, we have the tendon of extensor carpi radialis longus and extensor carpi radialis brevis. So these two muscle tendons are passing in the second compartment beneath the extensor retinaculum, as you can see here. Next, in the third compartment, we can see the extensor pollicis longus tendon. So this is the extensor pollicis longus tendon. In the fourth compartment, the tendons of extensor digitorum along with extensor indicis. So here you can see this is the extensor indicis and this is extensor digitorum. So both are passing beneath the extensor retinaculum in the fourth compartment. In the fifth compartment, we can see this is the extensor digiti minimi tendon. And in the last sixth compartment, we can see the tendon of extensor carpi ulnaris.